Hey guys, it's Sean with 65 and Covered, and today I'm going to show you how to use Medicare.gov to pick out a Medicare Advantage plan that works best for you. In this video, I'll help you organize a list so that you know exactly what you want before you look at any individual plans. I will help you use the tools available within Medicare.gov to quickly analyze every single plan that's available to you in your area. And in the end, I'll show you exactly how to make a final selection about which plan is going to be best for you. So if you feel like that's something that's going to be helpful for you, then stick with me, because today we're going to go through all three of those steps to pick out a Medicare Advantage plan that's going to work for you. I do have one quick disclaimer before we get into step number one. Today we're not going to be discussing Medicare supplement plans at all. We're only going to be focusing on the other half of the Medicare equation, which is Medicare Advantage. Medicare supplement plans are fantastic, but since over 50% of Americans who have Medicare Part A and Part B are enrolled in Medicare Advantage, I thought that today's video would be very helpful for that 50% to help them while they're making their decisions during this open enrollment period. So if you do want to learn more about Medicare Supplement and those options, they're amazing plans, they are fantastic. You can reach out to us on our website at 65andcovered.com. And with that out of the way, let's get started on looking at Medicare Advantage plans. Before we look at any given plans, we want to know exactly what it is that we want. The reason why is because Medicare Advantage plans offer a lot of very flashy benefits, such as dental, vision, hearing, gym memberships. But first and foremost, Medicare Advantage is medical insurance. The other flashy benefits are fantastic, but before we take a look at those, we want to make sure that we know what we want so that we're not left out to dry medically. The first thing that we're going to want to do is grab our pen and paper and write down a list of 9 items, which I'll show right here on the screen. And these 9 items are going to help us organize our thoughts so that we're going to be able to analyze the plans that we're going to look at in steps 2 and 3. Let's look at an example of how you can organize your list. Now, the information that you put down on your list will almost definitely be different from what I put down on mine, since we see different doctors and you might have different preferences than me. Starting with item 1 in the left column, we list out all of our doctors. In the middle column, we'll write down how many times we saw each doctor in the last year, or if you just started seeing this doctor, write down how many times you expect to see them this year. This will be important information when we compare our expected medical expenses between plans. And in the third column, we write down whether this doctor is replaceable, meaning if we find a Medicare Advantage plan that we really like, but our doctor is not in that plan's network, are we willing to find a new doctor that does participate in that plan's network? Once we have that, go ahead and fill out your information for the remaining items on the list. We'll be using all of these once we start looking at the plans. And here are all of my responses for this example. Now that we have our list and we know what it is that we're looking for, we can head over to Medicare.gov and start taking a look at some actual plans. So we're going to go straight over to Medicare.gov. And once we get there, we're going to go up to the top right here on the bar where it says Health and Drug Plans. And we're going to click on Find Health and Drug Plans. And we can scroll down, and right here, it's going to ask us for a zip code. This is going to be the zip code of wherever your primary residence is located. So we'll put in our zip code, click continue. Now it's going to show us 3 options of Medicare plans that we can sign up for or that we can look at. For this video, we're just going to go ahead and click on Medicare Advantage Part C, and we'll click on Find Plans. Now this is where item number 9 on the list that we prepared comes in. If you have Medicaid, you're just going to go ahead and click right there that you have Medicaid. This is going to show you plan options that are designed to work with Medicare and Medicaid that won't disrupt your Medicaid coverage. In this case, we're just going to go ahead and click I don't get help from any of these programs, and then click continue. Now it's going to ask us if we want to see our drug costs while we're comparing the plans. You're always going to say yes, because drug costs are a major part of any Medicare Advantage plan. And you're going to click next. Now it's going to ask you for a list of your prescription drugs. I'll type in some sample drugs. For example, levothyroxine is a very common drug for thyroid that a lot of people take. And here you're able to choose your dosage amount. We'll just leave it at the default, your quantity of how many times you take this every month, or every 2 months, or every 3 months. And once you've put in all of that information, you just go ahead and click Add to Drug List. We'll add another drug just for fun. So we'll put in some warfarin sodium. We'll add that drug. And maybe we want to put in 2.5 milligram tablet. And then we'll click add to drug list. Now we're done adding drugs. And here it's going to ask us to identify our pharmacy to make sure that the pharmacy is in network with the drug plan of whichever Medicare Advantage plan we're going to choose. Now, this is optional if in item number 6 of the list that we made earlier, you said that you don't really care if the pharmacy is in network or out of network, and you're okay with just picking whatever pharmacy works with the drug plan. But we'll go ahead and put one in anyway. We'll just say Walgreens because that's a very common pharmacy. And oh, look, this is the one that we want to go to anyway. So we'll go ahead and click this as our pharmacy. And then down here at the bottom right, you can go ahead and just click on Done Adding Pharmacies. Now we're going to move on to putting in your list of providers. So here we'll go ahead and we'll just put in Dr. Smith, and we'll say Jennifer Smith. And then we'll say Dr. Davis. Click Search Providers. I skipped ahead a little bit while I was looking at all of the providers just for the sake of time. But at the bottom here in the blue bar, you can see I've got my 3 providers. And now that I have them, I'll go ahead and click Continue to View Plans. Now, all of the plans that are available in your area are going to pop up. And here in this zip code that I put in, there are 54 Medicare Advantage plans that are available to me. Now, there's no way that we're going to go through all 54 of these plans and compare each one. That would take forever. But what we can do is start applying some filters based off of the list that we made in step 1. Right here at the top of the page, there are several filters that we can apply to start narrowing down this list. So we're going to start at the left, and this is our health plan type. It gives us 3 options: HMO, PPO, or PFFS. Today we're only going to be focusing on HMOs and PPOs. These are by far the most common type of Medicare Advantage plan. And we're going to use items 7 and 8 on the list that we made earlier. So that is, are you okay needing to get referrals in order to see a specialist? Or do you split time between 2 locations in the United States where you might have doctors in both locations? If your answer is yes to either of these questions, if you don't want to get referrals, or if you split time, then we're going to need to select PPO. The reason being that the core difference between an HMO and a PPO is this. If you have an HMO, they are going to require you to have a primary care physician, and if you ever want to see specialists such as a cardiologist, dermatologist, anybody beyond your primary care physician, you will need to receive a referral from your PCP in order to see those doctors. You're not able to just go to the dermatologist office and pick your own doctor there without first receiving a referral to go be seen by that dermatologist. On the same note as that, if you split time between 2 locations and you see doctors in both locations, then you will need a PPO as well, because HMOs are almost always tied to their specific service area. That means that if you are living in Georgia, for example, and then you have a house in California, and you sign up on a Georgia HMO plan, all of your doctors will need to be within that plan's service area if you sign up for an HMO. For that reason, we're going to go with a PPO if you split time between 2 locations. Okay, with that out of the way, we're going to move on to insurance carriers, and here is a whole list of every insurance carrier that's offering Medicare Advantage plans in this area. Now, if you have any preference against any insurance carrier, or if you love any particular insurance carrier, this is where you can filter to see their plans or to exclude their plans. I don't have any preference towards any particular carrier over another in this example, so we're just going to go ahead and leave this blank for now. Now we're going to move over to drug coverage. If you have any existing prescription drug coverage that is not part of a Medicare Part D plan, then you can go ahead and click Does Not Include Drug Coverage. This is very common for military retirees or military veterans who have coverage through TRICARE for Life, CHAMP VA, or VA Healthcare. Those coverages cover your prescription drugs, so then you can go ahead and click Does Not Include Drug Coverage. Everybody else, for the most part, is going to want to click includes drug coverage because the drug coverage, that Part D, is a huge part of our Medicare Advantage coverage options. So we're going to click includes drug coverage, click apply, and it's going to go ahead and refilter the list for us. And we've only applied 2 filters so far, but we can already see that we've almost cut it in half, cut the options available to us in half, and now there's only 26 Medicare Advantage plans that still meet our qualifications. That's still way too many to reasonably compare, so we're going to keep going with these filters. Now that we've done that, we can scroll down and start taking a look at our providers. I don't want to change any of my providers, so if an insurance company is out of network or doesn't participate with one of my providers, I'm going to filter them out of the list. And right here we can see we've got a Humana plan, and they don't work with Emily Davis. So I'm going to go up to the top here under insurance carriers, and I'm going to check mark every single box. And then I'm going to deselect Humana and click apply. All right. So now we've narrowed down the list even further by eliminating all Humana plans. We're not even going to consider them because if I were to sign up for one of those plans, I would then have to change my doctors. And this isn't for Humana specifically. This is just any company that doesn't work with my doctors. I'm going to take them off the list. Okay, so United Healthcare we just looked at. They work just fine with my doctors. Clover Health looks like they take both Emily and John Johnson. We're going to keep scrolling down. Okay, here's another one. WellCare. WellCare doesn't work with John Johnson. So I'm going to go back up to the top and take off WellCare. And we're going to go through the full list, and we're just going to look if we see any red marks while we're scrolling down. Through all of that filtering, we've gone from over 50 Medicare Advantage plans to just 4 in our area that could potentially work for us. So we've turned a huge list into a very, very manageable list that's going to work for us. So now we're actually going to start clicking into these plans and comparing the benefits so that we can narrow it down to the one plan that we actually want to sign up for. What our strategy is going to be is we're going to take 2 plans at once, and we're going to compare those plans against each other, and we're going to pick out of those 2 plans whichever one we like the most. We're going to take the winner of the first pair, and we're going to compare it against the next plan, and out of that pair, we're going to pick the winner, and we're going to continue down the list like that until we get to the final plan, and whichever plan wins out of that final pair is going to be the plan that we have decided is going to work the best for us. So now we're going to scroll down, and right here next to plan details, we're going to click add to compare, and you're going to see this blue bar pop up at the bottom. We're going to go ahead and click the first 2 plans in this list. We're going to click in, we're going to click compare, and now it's going to give us a bunch of data on both of these plans. It's going to show us the deductibles, it's going to show us the premium for each of these plans, so on and so forth. There is a whole bunch of data in this list that's going to talk about medical expenses and how much certain services are going to cost you. And depending on your medical situation and what kind of doctors you're seeing, you may want to go into greater depth than what we're going to do for this video. But for the purpose of this video, we're going to refer back to that list that we made in step 1, and we're going to look at items 2 and 4, and also the cost of prescription drugs that we wrote down in item 5. First thing I'm going to do is add up all of my specialist visits. I saw Dr. Davis 6 times last year and Dr. Johnson twice. So between both of my doctors, I had a total of 8 appointments with specialists this year. Now I'm going to take that number and scroll down here where it shows us the cost sharing for specialists. Here it shows us that United Healthcare is going to charge us between $0 to $55 per specialist visit, while Clover Health only charges $10 per visit. Okay, we're going to start a list of our expected expenses under each plan. We figured out earlier that we'll probably visit our specialists around 8 times this year. At $55 per visit under United Healthcare, this means that we expect to pay $440 over the course of the next year for specialists with this plan. Clover Health only charges us $10, so we expect to pay $80 for our specialists. Next, we'll look at our hospital expenses. So we stayed at the hospital for 4 nights last year, and we're assuming that it will be about the same this year. United Healthcare charges $530 per day for the first 3 days. So day 1, day 2, and day 3, I'll pay $530, and day 4 onwards, I'll pay nothing. Under this plan, I'll estimate $1,590 in hospital fees. With Clover Health, they charge $310 per day for the first 6 days. So for 4 days in the hospital, I'll pay $1,240 in hospital fees. Medicare.gov does a really good job of displaying the most common medical services that you could run into and their costs. I only used specialist visits and hospital days in this example, but if you expect to go to urgent care or the emergency room or any other service that are shown here, you'll want to take the same approach that we did just now together for our specialists and hospital days and count up how many times you received any of those other services and add them to your list of expenses too. Let's scroll to the very bottom and we'll take this row for the total drug plus premium cost and add that to our list of expenses as well. Now we can go ahead and add up all of our total estimated expenses, and it gives us a total of $2,030 for the year with United Healthcare and $1,320 for the year with this Clover Health plan. So that looks like a pretty good estimate for how much we can expect to pay under each plan this year. But before we move on, we need to take a look at 2 more crucial pieces of information. Let's scroll back up to the top and we're going to look at 2 things: the health deductible and the maximum amount that you pay for health services. You can actually ignore this drug plan deductible because that's included in the total drug plus premium cost that we just looked at. This health deductible means that you are responsible for paying the first $1,000 out of pocket before the plan coverage will kick in. However, this deductible might not apply to every medical service. You can check which services this deductible applies to by going to the carrier's website, in this case United Healthcare, entering your zip code, searching the plan name, and opening either the summary of benefits or evidence of coverage. In the summary of benefits, we can see here that the deductible only applies to a handful of services. It does apply to our inpatient hospital stays, so we'll go to our expense sheet and just add a note that there is a $1,000 deductible for hospital stays that we will have to pay before we receive any coverage from the plan. This Clover Health plan does not have a deductible, so that's very nice. Next, we look at the maximum you pay for health services row. This is my favorite benefit that Medicare Advantage plans provide. Here's how it works. Regardless of how many medical expenses you have in a single year, you will never have to pay more than the maximum amount for covered services. For example, this United Healthcare plan includes a $9,250 in-network limit. So even if you racked up $1 million in medical expenses over the course of a year, the most that you would have to pay is that $9,250. So this benefit is great because it protects you from huge medical costs. Here we see that the plan on the left offers a $9,250 in-network maximum, while Clover Health on the right offers a $6,700 limit. We can head back over to our list of expenses and make that final note that this Clover Health plan has that lower limit. We now have a pretty good estimate of what we can expect to pay for each of these 2 plans over the next year. And we also know how protected we would be if we had a really big medical expense. Remember, of course, that this is just an estimate, since it's hard to know for sure what will happen to us medically over the course of an entire year, but this is based on the best information that we have at our disposal. And now we can finally take a look at the fun stuff. Those extra benefits beyond original Medicare like dental, vision, hearing, and so on. You can take a quick look at which benefits are offered under each plan here on the Plan Features row. It's up to you which benefits you care most about, but let's take a closer look at the dental, vision, and hearing benefits. Scrolling quickly down to the dental information, we can see that both plans are pretty much the same for preventive dental coverage. But Clover Health covers comprehensive dental, while this United Healthcare plan does not. This UHC plan also does not cover eyeglasses, while Clover Health does. And finally, we can go up and look at the hearing aid coverage. The coverage here actually looks pretty similar, with the in-network copay ranges for hearing aids being shown here. Let's add all of that information to our comparison list, along with any extra benefits that you're interested in. And now we have a list of key indicators that we can use to decide which of these 2 plans we prefer. On the left, we have the United Healthcare Medicare Advantage plan with an estimated $2,030 in total expenses, plus a $1,000 deductible, so our true medical cost will probably be a bit higher, and a $9,250 maximum out-of-pocket limit. This plan provides preventive dental and hearing aid coverage, but does not cover comprehensive dental or eyeglasses. On the right-hand side, the Clover Health plan's total estimated expenses are around $1,320 for the year, with a $6,700 maximum out-of-pocket limit. It covers preventive and comprehensive dental, eyeglasses, and hearing aids. Look at these two plans. Does one of them look like the better option? Before we went through this exercise, we were dealing with an overwhelming amount of information, but now we have refined the data so that we can easily see that in this case, Clover Health offers a better deal between these two plans. You can go on to repeat this process by comparing this Clover Health plan with the next plan, and then comparing the winner of that pair with the plan after that, until we arrive at a single winner, a single plan that meets your needs. Your plan might not be the same as my plan. It of course depends on the doctors, the preferences that you wrote down in that list that we made together. But if you followed these steps, we've been able to narrow it down to a single policy, a single Medicare Advantage plan that's going to work for us. And before you go, if you felt confused as we went through these steps, or if you ran into any roadblocks that you weren't able to get around, then just know that you're not alone. Medicare and Medicare Advantage can be incredibly complex, and not everybody's situation is identical. With that being said, I would recommend reaching out to a local Medicare agent in your area who can help walk you through the options for you and your specific situation. If you would like to work with us, then you can go over to 65 and Covered and write us a message, and we would be more than happy to help you through your Medicare journey. If you did like the video, then go ahead and subscribe to the channel. And with all of that said, thank you so much for watching, and we'll see you in the next one.